Howdy. I'm going to start with a fact, and maybe you already know this about our state. Did you know that Texas has the largest rural residing population of any state in the nation? Okay. Did you also know that Texas has over 400 healthcare provider shortage areas? And did you know that a significant number of those, in fact, highest proportion of counties of any state, are designated as mental health provider shortage areas? Yeah, in 5 counties, we have over 2/3 of all licensed psychologists that we have in the state. 5 counties, the most populous, of course. So what happens when people don't have access to quality mental health services? You have problems with lost work hours. And our communities then face problems that are associated with the increased cost of emergency care and increased costs that are associated with law enforcement assistance. And this isn't taken into consideration, of course, the problems that we have, personal and in relationships, that people experience when problems are untreated and unresolved. What do we do about it? Well, actually, there's quite a bit we can do about it. We've known for years that we can use long-distance technologies to address this kind of problem. The military's been doing it for at least 2 decades. Long-distance technologies, high-speed internet, broadband, video conferencing, all of these technologies can be used so that we can provide quality services from one site to a remote site. What does it take for us to do that? Well, I can tell you, the Counseling Psychology Doctoral Program, working in collaboration with other colleagues on campus and with several community stakeholders, has been doing this very thing. We started in 2009. We started when local community leaders approached us, which I'll tell you more about in a moment, and asked us if we could help them find a way to provide services to a remote site in Centerville, Leon County, an hour away. And so we did. We designated a room in one of our clinics. We had the right students involved, and that's the trick here. Our advanced doctoral students provide the services under the supervision of a licensed psychologist. Now, since we've been doing this, we've conducted over 5,000 individual sessions, and we've seen over several hundred clients. As our success in Centerville began to leak out from one county commissioner's court to another, we eventually set up a remote site in Madisonville, and now we're in Navasota, we're in Brenham, and we're also at Health for All here in Bryan. Now, there are 3 important things I want you to know and I want you to remember about the Counseling Psychology Program and our Telehealth Counseling Clinic. 3 things that I hope you take from this. First, this is a very unique and I think wonderful community and university partnership. This was not the brainchild of a faculty member daydreaming in the office about what to do next. That's not how this worked. Community leaders, and I mean volunteers with Brazos Valley Health Partnership, people who, leaders that were working with Brazos Valley Council of Governments, they came to us because they have known for years mental health issues are chief among the concerns throughout all of their communities, and they needed services. They came to us, and we partnered with them. Okay. So there's an incredible degree of volunteerism at work here. Our students learn firsthand community engagement. Yes, they provide the therapy services, but all of our students are required to visit these clinics, to visit Faith Mission in Brenham, to learn staff, to meet the community leaders, and learn about these local communities. They're out of the classroom. Yes, they're learning modern technology and service, and they're engaging and learning from community leaders. I think that's a great thing. Second thing I want you to know, our services are effective. We've already crunched the numbers. We know that for most of the people that we see, they experience considerable declines in their distress, and they feel so much better after 4 sessions. Some certainly have more entrenched problems, and we need to work with them longer, and we do. But there's another piece of data that also should give you some idea about effectiveness. A year or so ago, I received a phone call from one of our representatives in a local state mental health agency office here. He calls me up and he's looking at his information and he says, you know, in the counties that we serve, he's under budget for the money he allocated for emergency services. But he's looking at the counties we don't serve, and he's over budget in emergency services. And he says, Tim, we got to get you in these counties. Here's the third thing I want you to know. And this might be the most important, maybe it depends. We're number one. We are number one. To my knowledge, to the best of my knowledge, of all the accredited doctoral programs in counseling and clinical psychology, we are the only program operating a telepsychology clinic. We're it. It's interesting being a national leader because that puts us in a responsible role to work and confer with others, and we've been doing that. The clinic director, Dr. Carly McCord, has already been working to develop continuing education modules. We've published guidelines on how to train psychology doctoral students in telepsychology. We also consulted a few years back with our colleagues in Sam Houston State as they were considering telepsychology services. Dr. McCord also has a grant from the Southeastern Conference, and later this month, a colleague from the psychology department at the University of Arkansas will be coming down to learn from us how we operate so that he can go back and they can set up a telepsychology clinic to serve counties in Northwest Arkansas. We have trained over 50 students, mostly in counseling psychology and some in public health, who want to learn more about how to operate and evaluate mental health services that are provided via telepsychology. The counseling psychology program working through the Telehealth Counseling Clinic is training the next wave of psychologists. Psychologists who can then go out surfing the internet wave of the future to provide quality mental health services to our rural and underserved communities. Thank you.